As far as ALF appliances and cranial sacral rhythm, the first thing I'll say is I'm not an expert in this area. I'm not an osteopath or anything like that. But cranial sacral flow is very important. Basically, what that is, for people who don't know, we have fluid in our spinal column and in our brain cavity. It circulates around, up and down, through, and there's no heart or any pump that really circulates it. What really occurs is the bones in the head will kind of expand and contract at a really slow rate that's hardly detectable. And as we walk, our spinal cord will like move around, and that action of these bones puts pressure, moves the cerebral spinal fluid up and down our spines and around our head. Really, what we're trying to do when we do appliance therapy, we're trying to introduce appliances that will not get these different bones in the head. All these different colors in here are bones where there's ligaments and they come together. If we start putting a lot of pressure on the maxilla to expand, that can put pressure on the other bone. They can become stuck and not move well. That could disrupt our cranial sacral flow and the distribution of our cerebral spinal fluid. So we really don't want to do that. What we do is we use slow biological expansion. That is, we're trying to use pressures that don't exceed the type of pressure that the tongue might place on the bones unless we absolutely have to. But as far as the ALF appliance goes, the ALF appliance is a little springy wire that you can adjust it so it gets wider. You can adjust it so one side's higher than the other. It puts very light pressure on the cranial bones. So in that way, if one actually knew how to use the appliance, you could actually improve the cranial sacral balance, or really specifically, the actual way in which the cranial bones come together. The negative of the ALF appliance is it really doesn't get a lot of volume of expansion. Patients who come to see me, they may need like 5, 10 millimeters of palatal expansion, and the ALF appliance is not going to come anywhere near doing that. So what we try to do is we try to introduce appliances that will put light pressure, not make the cranial structure worse as we get it larger. That's really the key. I think make it better, not make it worse if we're doing anything at all. And if you really want to understand just kind of what's going on here, I've done videos about this before. The head really consists of like the brain cavity and the face. When we're getting growth and development, we're doing things to the face. Really, the only bone that's a part of like the face and jaw structure as well as the brain cavity is this red bone in here we call the sphenoid bone. When you do things to the maxilla, which is what we're doing with our appliances, there's an opportunity to level this bone out, obviously get it wider, get it better in the up and down direction. And the ALF appliance is actually quite good at making small adjustments to that. Probably the most key connection in the cranial bones is the connection between the maxilla and the sphenoid bone. That connection can be improved with the ALF appliance and appliances that have biplanes. I think one really big thing when we diagnose and treatment plan our patients is to recognize patients who may already have issues with their cranial structure. For your adult patients who are coming in and they're already complaining of like a lot of headaches, ringing in their ear, they say that they're really sensitive towards a lot of things. They may have some like neurological problems. You have to really ask ourselves if maybe these people already have some cranial imbalances. When I take a look at the CBCTs and I'm looking to see if people have facial asymmetries, we can take a look at how all their cranial bones are coming together. If there's really a lack of balance in there, those are things that we really need to pay attention. Because if you take a MARPE and you put that appliance in there, you already have a lot of cranial problems, maybe disrupted cranial sacral flow. You start putting a high amount of pressure, it's going to put these people into a lot of pain. You really are going to make them worse. That's when an ALF appliance might help, because even though it's not going to get you a high volume of expansion, you can get in there and you can actually improve the relationship between some of these cranial bones if you actually know what you're doing. and then move on later once the symptoms have gotten better to Mass B or some of the other appliances that can get more expansion.